name's Patricia Murray. I'm a professor of stem cell biology and regenerative medicine based in the Department of Women's and Children's Health at the University of Liverpool. Another aspect of my work besides the basic research is that I'm quite concerned about the inappropriate use of stem cell and regenerative medicine therapies. And unfortunately, we have quite a number of clinics in the UK that are offering unproven therapies to patients. And the number of these clinics has increased quite dramatically over recent years. So this is why I became involved with the 99% group, which is really setting out economic rationale for why we should have better funding of the NHS so people can get more timely access to the care that they need. But of course we do need to have better regulation as well, and unfortunately at the moment there seems to be a reluctance to regulate some of these therapies. What we found when trying to engage with policymakers is that, many policymakers are very receptive to the case that we're making. The challenge for us is to try to convince policymakers who may yet be undecided about the way forward for the NHS. So those are the people that we really want to have some access to and present, the data in our report to convince them that that is actually not the best way forward. So I think the key really is to interact with a policymaker who you think is going to be receptive to your cause and hope that they will then, help to raise publicity around it. But you also do have to be persistent, and it's important not to give up at the first hurdle, because sometimes you have to try and contact many people before you'll find someone who will actually take up your cause. So persistence is really key. I would encourage researchers to engage with policymakers because you can help to shape policy. I would encourage people to look out for the type of inquiries that are being run by the Science and Technology Committee and the Health and Social Care Committee, because this is a great opportunity to get your voice heard. If the policymakers don't know there's a problem, then they can't fix it. And I think we actually have a public duty in some cases to try to effect change.